right. Hello, everybody. Welcome to Lecture 3. I hope you all are having or had a great weekend. I am your instructor, Mrs. Frazier. This is Introduction to Public Health. We're going to do a short video on half of the chapters that we're doing. We're doing chapter 11, 12. We'll try to get to 13, and then we'll do a second half of a video, the other video for the other lecture. Anyhow, I hope you all had a safe weekend, holiday weekend. Happy 4th. And I hope you all are doing well. Okay. I'm doing these videos just to make sure that you're understanding the lectures, PowerPoints, what is to be expected for the week. Okay. I'm debating on doing Zoom either Tuesday late afternoon or evening or Wednesday. I will keep you posted. Hopefully I will post either Sunday night or Monday. Okay, so be aware of that. I'll put it in the announcements. Okay, so let me share my screen and let's get started here. I wanted to show you a little bit about, because I'm going to be giving you just to touch on chapter 10. HIV started when hunters in West Africa killed and ate infected chimpanzees. So I want you guys to be aware of that because it might be on a quiz. Just to read up, I updated this chapter or these PowerPoints, so just it's connected to 10 and 11. But I just want you to have that little idea of HIV and where it was, where it started, and so forth. Okay? All right, so let's jump to chapter 11. And this is one of my favorite chapters because it talks about chronic diseases. And like I mentioned to you guys before, I am a registered dietitian. I work in cardiac rehab, pulmonary rehab, and heart failure. So I don't just do this, but I also work in an outpatient setting as a dietitian. I've been a dietitian for over 12 plus years. All right, so chapter 11, chronic diseases. So chronic means long term. It doesn't mean it just like for acute is short term, chronic is long term. Okay, so it's long term diseases. The top disease is heart disease. Okay, over the past 30 years, what I've seen in research, the #1 killer in America has been heart disease, unfortunately. And it's preventable through diet, lifestyle. Sometimes genetics play a huge factor, but again, having a healthy diet, making sure we're getting checked up, and things like that. So just to be aware, if you have that in your family, go and get checked. Okay. Second leading cause of death is cancer. Third, unintentional injuries, chronic lower respiratory diseases, stroke, Alzheimer's, diabetes, influenza, pneumonia, kidney disease, and suicide. Okay, so be aware of that. So chronic disease is not deadly in short run, but in severe impacts on quality of life. So causing disability, causing other issues for people to either not work or have the quality of life that they need, unfortunately. Multiple cases, risk factors, less recognizable, and we'll go over that. Long-term period onset, possible secondary prevention. Okay, we'll talk about that. Cardiovascular disease, what that is. It affects the heart. It affects about 82.6 million Americans live with cardiovascular disease, and it's growing. And more than half are under the age of 60. Young, very young. Seeing younger people, and it's crazy. So you can see here mortality of non-communicable disease by country. Okay, we're of course #1 with heart disease. Death rate due to heart disease by ethnicity and race. Um, it's just showing correlation between this. Okay, so a little bit more common in men, but women do get it. I've had many patients that are women, and their side effect, of course, is not the same as men. One patient she had a triple or quadruple bypass, and she was young. Her weight was good, and she just had sore triceps. She just thought, wow, I wonder what I did to have my triceps sore, and that was a side effect. All right, so cardiovascular disease, any disease involving the heart and blood vessels. So you can see here in this picture, damage in the lining of the blood vessels, cholesterol buildup, and plaque buildup, plaque deposits. So it's not letting you have blood flow. So we want to pay attention to cholesterol, okay, and diet, and many other things, okay. These are different areas of the brain, and that causes hemorrhages, stroke, different areas of stroke. So review this. Okay, death rate from just has decreased, even though we're seeing a lot more people have the disease, but we're able to treat it and get it quicker, get treatment quicker. Seeing signs and symptoms, having a great team of assessment people, check up at the doctors, dentists, things like that. Having regular checkups can help really pay attention to see if people have risk factors for heart disease. Okay. All right. Plaque begins at an early age. It starts from as early as 2. Just diet. All right. And I'm going to have you guys watch some videos and respond to those, and we'll talk about that either this video or the next. All right, of what you guys need to do for your discussion activities this week. All right, risk factors for cardiovascular disease. Assessing your risk factors. Tobacco use, huge. It affects a lot of different other chronic diseases. Tobacco does. It incorporates a lot of others, but again, it's one of the #1 risk factors of heart disease. Blood pressure, high blood pressure, which is also known as hypertension. Cholesterol levels, high cholesterol levels. Physical inactivity, BMI, uncontrollable diabetes, and diet are huge controllable risk factors. But having these controlled and doing well puts you at a lower risk. Okay. All right. Pay attention to this cholesterol guidelines. If you guys are going into nursery or any other health profession, you want to be aware of this guideline for cholesterol. You will know this backwards and forwards, but again, for me, I just wanted you to understand it and be aware of it. Okay. Exercise helps lower cholesterol and increases that HDL. So there's 2 cholesterols. You have your LDL, which is your good cholesterol. Think of it as the trash truck picking up the trash every week. Okay. LDL, not so good. It builds up trash. Okay, so think of those 2 things, good, the bad. So when you exercise, it increases the good cholesterol, which you want. Okay, it decreases the lower. Or it lowers the bad one. Okay, public health approach to heart disease over the past few decades, we pay attention to it, but these are some ads that are pretty funny. But taking care of your blood pressure, some people don't really pay attention to their own health, but being more aware of your blood pressure and approaches to heart disease and things like that. Another thing, as a dietitian, we're changing our language of how we're trying to get people in a healthy weight. And so for me, I try to approach it as you need to get to a healthy weight because you need to, if you want to ease, not be disabled, we're able to go from one room to another, depending on the patient, okay? It's very sensitive subject when it comes to weight, when it comes to diet. So there's a different language now that we have to use. So, but these are risk factors that we look as a healthcare professional. If they're men, we want to do a waist circumference, measure them. We want it less than 40 inches. Women, less than 30 inches. If they're Asian women or men, we need to keep it under 36 or 32 because they have a smaller frame. Okay. So this is a correlation of increase of deaths, cardiovascular disease. You can see the risk factors here: low fruit and vegetable intake, blood pressure, high blood pressure, tobacco use, if they were overweight, obesity, physical activity, and cholesterol. So all of these have a factor in cardiovascular health. And a lot of it is diet and lifestyle. Okay. Blood pressure, You need to be aware of what this is. Systolic, diastolic, review this. Okay. Is an important risk factor for cardiovascular disease. Be aware of that. Hypertension is known as high blood pressure. Essential hypertension is also has no cause. Okay, a lot of that could be stress. It could be a lot of different things. That could be a reason why. So be aware of that. Regular physical activity, at least 30 to 60 minutes a day when you're moving, either cleaning or you're up. What I ask patients to ask, how long do you sit versus do you work out? Okay, so I change my language in how to ask patients on how, or clients, of what they do for physical activity. If they're up, they're moving, they're gardening, they want to walk. If they're not, how long are they sitting a day? Okay, so there are a lot of different approaches on how to ask patients sensitivity wise. Okay, so the DASH diet is known for dietary approaches to stop hypertension. So it's increasing fruits, vegetables, whole grains, paying attention to leaner meats, less unconcentrated sweets, lower in saturated fat and cholesterol. Also sodium, having a diet low in sodium we tried to recommend because people have a higher intake of sodium and an imbalance in their diet. Okay, it holds on to a lot of water, a lot of fluid, puts a lot of strain on the heart. So we try to monitor and make sure they go under a 2,000 or 2,300 milligram of sodium a day. Okay, just no processed, cook more of your food, use different herbs and spices instead of that salt, pepper, get away from the convenience foods, cook more at home. Okay. Cancer, assessing risk factors. Okay, so cancer arises from mutations in DNA. Okay, be aware of that. Mutations are caused by chemicals, viruses, and radiations. Condition characterized by uncontrolled growths of cells developed from a single cell that goes weary, and combination of events must occur during the cell in turn to turn into a tumor. So it takes some time. But again, cancer arises from mutation in DNA. All right, be aware of that. All right, so these are just new cases, estimated deaths of different cancers. Healthy cells divide when needed to replace cells that have died or been sloughed off. Each time a cell divides, there is possibility of mutation or error of DNA replication. Okay, mutations are always occurring randomly, but the risk of mutations have increased with the exposure of tobacco use, smoking, radiation, toxic chemicals. This could be also use of vaping as well. There are getting to be more studies on this as well with cancer related and damage. All right. Risk factors for cancer. Environmental, be aware of this: sunlight, radiation, chemicals, physical, carcinogens, infectious agents. Okay. Skin cancer, pay attention when you're out, or sunscreen if you're going to be in the sun for more than 30 plus minutes. We want to protect our skin, okay, and protect our bodies. All right, so Marie Curie, she was one of the founders and found the causes of mutations back in the 1890s. So be aware of her and read up on her. Okay, causes of mutation. This is HPV, cervical cancer. We've seen this in assessing cervical cancer and what happens, infection of HPV over the past 30 years, how it develops cancer in the cervix. And actually I'll go back. So this is what normal cells and how it mutates into a cancer cell. Okay, so be aware of this, review this slide. Examples of how multiple mutations are necessary for tumors to arise. Read this page, this slide. Stages of cancer, you want to read this and review it. Risk factor for cancer, family history. We'll look at this when we're assessing, so please be aware of that. This is Angelina Jolie. She was inherited of the defective BRCA gene, gene for breast and ovarian. So again, it does run in the family. Okay. Physical inactivity can cause 3 types of cancer: breast, bowel, womb, um, also pancreatic, gallbladder, things like that you want to be aware of. So they're just seeing a correlation, okay, especially in women, and also being overweight. So read up on this slide, pay attention um, to the different risk factors causing this. It's very interesting. Okay, also alcohol and mouth cancer risk. This puts people, when they have just excessive drinkers, how they're drinking, it increases throat cancer, um, breast, bowel, liver, and more. Okay, so please read this slide, be familiar with this slide. Diabetes is a deficiency in able to metabolize sugar. It's really carbohydrates. Breaking that down to, it helps break down the cell to provide energy. Carbohydrates is about energy. We need carbohydrates for us to have energy, to make our brain function, things like that. So what insulin does is, from the pancreas, produces a hormone called insulin. So when that's altered, if the pancreas is altered in any way, you might have diabetes type 1, where it's not really functioning, a little bit of function. Type 2, it's functioning, but erratically. Okay. Seeing this in a range of people in age groups. Type 1 is usually younger. I've seen it in 30 and 40-year-olds when they're diagnosed, which is very fascinating to me. But usually it's supposed to occur under the age of 20. Okay. Type 1, what you know about that? Type 2, onset gradually, pre-diabetes between 100 and 126. Dietary changes, exercise, weight loss can prevent or delay onset. Type 2, where it's kind of working, but it's not, is showing a little bit of insulin resistance. Okay. How inflammation contributes to obesity and diabetes, because we're not really being as active, we're not really giving our body good nutrients, and so this causes resistance with our cells and inflammation. Okay. Exercise is a key factor in helping blood sugars, controlling weight management, things like that. Weight stability, healthy weight, just incorporating that in a diet can really help with blood sugars. Not sure if any of you are diabetic. If you are, please let me know. Even when you're doing a comment, I'm diabetic. I've been diabetic for that long. It's good to see some diabetics. Okay, I love diabetics. All right, so when you're diabetic, there's a lot of other conditions that can have complications: stroke, heart disease, very high correlation. When you have diabetes, you have a high risk of getting heart disease. Okay. Also uncontrollable, you have neuropathy, retinopathy, those when you're starting to be uncontrolled. So the eyes, the kidneys, the nerves, things like that. All right. Other chronic diseases of importance: Alzheimer's, depression. This is arising, especially what's going on, depression and suicide, unfortunately. Just the unknown, how we're coping and dealing. That's why mental health is so crucial right now in helping people. Importance of animal modules. So ethical concerns limit the type of experiments that can be done on humans, so they try to do it on animals. Majority of biochemical and physical processes with humans, because of their short lifespan, effects of various exposure and interventions can be studied over a lifetime with animals. So we have to pay attention of how we're doing and which animals we're using, because it helps to figure out some things, but it can't find a lot of things because we have to see if it works in humans. That's what clinical trials are for. All right, so that's the end of 11. Let me try to go to, all right. Okay, so pterygens are, this is chapter 12, are substances that can cause birth defects. And we're just going to do just a short video of this lecture. So I just want to just briefly talk about this, and then the next lecture will be 13, 14, 15. Substances that may cause birth defects affect an embryo or fetus. Be aware of this slide. Okay? And different varieties of these. You want to be aware. Okay, what causes these issues? Okay. Mercury and poisoning started in the 1950s. Okay, very sad. And we'll talk more about this. Fetal alcohol syndrome, birth defects when women are drinking during pregnancy, genetic diseases, especially in all information, new human is being contained in a genetic material, 46 chromosomes, as we know. Half is the mother's egg, the other half is the father's sperm. More of half pregnancies in healthy women, spontaneous and in spontaneous abortions, or chromosomes abnormalities, and so forth. Okay, being aware of this. Down syndrome. Okay, caused by presence of part of the third copy of the 21 chromosome. Okay. There's also another interesting. Okay. Sickle cell anemia, being aware of this. Doesn't carry as much oxygen to the cells. That's what happens with sickle cell. It's a genetic passed on. And so be aware of that. Genetic diseases, genetic makeup also influences people's way of understanding a disease from adulthood, not able to live a quality of life. Genetics, a lot of times, it could be cholesterol, it could be heart disease passed on. A lot of things are passed on. That's why it's good to be aware of your family tree, things like that. Okay, so I'm going to just stop here and I'll do another video for the rest of the lectures. Sorry, I'm just trying to make sure I cover what we're going to be doing this week. So make sure you go into your module. Okay, I set up for you guys for week 3. You have your PowerPoints and then videos to watch. I want you to watch these videos. Try to watch all of them. Respond 300 words or more is fine, and then respond to a student. It may take you a day or two to see other students respond, but I'd like you to respond to a student. This is in the discussions for this week, but again, it's in the module and you'll see that here, okay? I want you to fill out this Heart Healthy questionnaire, and then you're going to do quiz 2, okay? It's about 30 questions, going over the chapters 11 through 15. I will do another video with 12 to 15. I just was doing a quick video right now because I'm trying to split it up and not be so much and so fast, okay? So just for that, and I'll let you guys know on an announcement when we're going to have the Zoom, the live Zoom, trying to accommodate many people because I know people work, people have busy lives, and so I'm trying to accommodate y'all. But I will have a recording for you guys that are not going to be able to be there, so do not worry for this week because we want to prepare for the midterm. There's a lot of chapters that we cover, and I want to make sure that you know what we're going to be needing to study, okay? I hope you all had a good weekend and a good week, and I'll talk to you soon. Any questions or concerns, email me. Don't worry about bugging me. Email me if you have a question. I'd rather hear from you guys, and I worry if I don't, okay? All right, I'm going to stop sharing my screen. All right, have a great rest of the week. Look for the other video I will post in after this one, okay? Thank you. Bye-bye.